Okay, so we're going to do our video lecture here. Per Alex's request, I got the Derby going. Congratulations on graduation. Not a great gift. It's something. I also try to make like a little aesthetically pleasing. This is kind of in my dining room. So I got the little, whoops, I'm not getting my finger around this. Got kind of a nice little piece of Tibetan art over there. I have a teacher of mine who brings sort of like work from Tibetan artists over to the States, so I try to support the arts a little bit, so that's good. Okay, down to the business of the video. So we have this, obviously this time to fill, right, from the time that I was out of town. I sort of set aside some of the material that seemed like it was convenient to talk about from the handouts. For this one, we're going to use this particular handout over here. It's kind of on the back, on the shoe transport points it starts with, and then we kind of walk through the handout. And I will test on this stuff for the exam next week. So we'll go as far as we can. I think my goal is to have probably around an hour of video or so, maybe a little bit less. We kind of stayed late in class last time. We weren't really out the door till maybe 5 after. So we may have some time there. And I think what I'll probably end up doing is do a little short lecture in the beginning of next class just to cover this stuff again real quick. Review anything that might be confusing for people on the final. Though a lot of it I think will be sort of just memorization of these categories again. So that's sort of the goal, probably in a couple of videos, and then you'll get the email to the email address through National, and you can just kind of find it at the YouTube account that I'll kind of do the link to. So anyway, so that's the deal, and so we can start doing this right away, or not right away, but after introduction. A little bit of coffee here. All right, so this is just a handout just kind of going over some of the last stuff that's review on point categories. Again, we'll see how long this takes. I'll go through it. Time allowing, I'll also probably talk a little about the case study, the last one that we covered, and kind of wrap up our whole class. So first of these is a review of the shoe transport points. It starts by talking about this sort of circulation model theory. We all sort of get this. These meridians go in circuits, so the in meridians of the hand run from the chest to the hand, and then the in meridians of the feet run from the feet to the chest. Yang meridians of the hand go from the hand to the head, and the yang meridians of the feet run from the face to the feet. So this kind of creates the directionality of this. And then when you tie these things together, obviously you get this circuit. So there's a way in which these things have a certain movement to them. Basic idea. And that leads to the whole circulation theory. So the other way of framing this, which is interesting, is that you can kind of follow that first model where you imagine the meridians kind of connecting into one another like a circulatory system. Or you can go through and you can say, well, it's a little bit more like a centripetal model, where all the flow starts at the periphery, at the distal parts of the channels, and then kind of finds its way back in, and then homes to wherever those meridians home. So this is a different way of framing the question, right? So you can imagine kind of a flow that starts at the Jing well points and then finds its way back up to the end of the channel. So that would mean the yang channels go distal to the head, which is convenient because the head is the yang structure. It's kind of round like the heavens and all that kind of stuff. And then the yin meridians find their way back into the chest, which is sort of the more yin part of the body and kind of square like the earth or something like that. So that's sort of the general gist of this, right? We had talked about this all the way back in physiology, but if you think about the old Chinese coins with the circular coin with a square hole cut out, how do you do square like this, like that? With the square hole cut out, that's the symbols of yin-yang joined together. And so the Chinese culture always likes to kind of play this yin-yang game where it's applicable to be played, and when is it not? So yang meridians going to the yang part of the body, yin meridians going to the yin part of the body. So the other argument, and this is John Parag kind of makes this point in his book, which is that there's a self-contained kind of more agrarian model when you connect one channel into the next, like lung into large intestine, into stomach, into spleen, into heart, and so on. There's kind of a flowing kind of a thing, and maybe for a Chinese farmer, you think of this kind of flowing of time and the channels connecting, capturing that same thing, and then it repeats with a cycle all over again. So if you're a farmer, that's maybe how you think. That's his argument. But if you're thinking more from a Qigong point of view, a different energetic model, then you kind of imagine flow from the periphery going back to the structures that are more proximal, like the head and the chest. So kind of two different general theories of circulation kind of there. And they have different implications. And again, it's not these things where you say one is right and one is wrong, obviously, but you kind of just can apply them accordingly where they fit, because the Chinese, are flexible on those kinds of points. So I think Parag's idea is that the transport points fit a little bit more into this Qigong-y kind of centripetal model, distal to proximal model. And so there you go. All right, next point, 5 phases in the shu transport points. Of course, we already did this, so this is just a review of what we already kind of saw. It showed up on the midterm too. Probably some questions like this will show up on the final too. This idea that the obviously 5 phases are assigned to these major points, and we know the yin channels start with wood and kind of climb back, and the yang channels start with metal and climb back, and we know that the yang channels are the controlling relationship, are in a controlling relationship to the same phases in the same category, and the yin channels, that's basically the deal of how it works. Next page. So what we're gonna work on here, and it's gonna be a certain amount of memorization with this. I'm gonna review stuff that presumably was memorized in point energetics, but that was a long time ago. And this stuff always slips out of everyone's head. I certainly can remember this as a student too. So we're gonna review these, what they sometimes call antique points, these transport points and their functions. The Nanjing has this sort of 5-phase idea. We're on page 2 here of this, kind of towards the top. We have the Nanjing, emphasizing the 5-phase qualities, maybe even a little bit more than the Ling Shu. I suppose that's debatable. That's what people tend to say. And so then these 5-phase functions are then interesting, and we practice this a little bit with the Japanese thing. So for example, lung 9 is the earth point. And earth tonifies metal, therefore lung 9 becomes a tonifying point for the metal phase of the lung or something like that, right? So if you want a tonifying point for the lung 9, and just in general then, look at some of the ideas of some of the other points. So, you could use lung 5 to tonify, especially if you want to tonify yin because it's a water point. But in general, in the generating cycle, you'd say, well, lung 9 is the most important one because it's an earth to generate, it's an earth to generate metal thing. All right, other example on the sheet here is stomach 45, metal point to drain the earth. So if you want to do a little bit more aggressive needling or something like that, you could use a point like that. Classically, people would do it. So these are both using the generating cycle, but of course you could use the controlling cycle or other theory to make this work. So classical usage of this, it's in the Neijing and the Ling Shu. This is more sort of based on water imagery. This is the point that's made here. You have a 5-phase way of thinking about this. You have a water imagery way of thinking about it. They probably overlap somewhat, and we'll see that as we go through the review. We'll kind of reference some of the water stuff and some of the 5-phase stuff, in the same conversation. But in any case, there's a flow of energy going on here, and it's a water building, and so we know we have Hesi points and Jingwell points, and they do different things based on sort of where they're at. So the Jingwell is the start of the flow, and that means something in terms of the effects of those points. The Hesi points is where the flow is building up to the point where it's connecting into the sea, so that means those points are considered to kind of start to connect into the interior of the body. And again, some of this, as I have here after example 1 and example 2 on the sheet, is 5-phase related, and it's pretty clear. So as an example of a 5-phase relationship, you have the Jing River points that treat the voice. They're metal points on the yin channels or fire points on the yang channels because of that controlling relationship thing. And so they're somehow affecting the metal. And so the treating of the voice thing is pretty logical from that way of thinking. So in this, you'll see this combination of flow imagery. You also see this references to things that are pretty easy to understand by 5-phase kind of concepts. So that's the basic gist of this. So Jingwell points are the points at which qi emanates. That comes from the Ling Shu, and I guess I have little pieces of the Ling Shu the whole way through here, I think. Pieces here and there. So because they're at the end of the channels, they can kind of be used to sort of drain the channels out. You're going back to the starting point of the flow, and you're kind of affecting the flow at the end. So I think we all have this idea. So they can be used to clear heat. Good examples of this are lung 11, which is kind of bled a lot for things like sore throat, or stomach 45, which you don't see in TCM, but you'll see in older books when they're trying to drain out heat from the stomach, for example. These points also treat the upper parts of the channels. That's based on the theory that the more inferior you go, the more superior the effect is, or in this case, the more distal you go, the more proximal the effects are. Not proximal, I guess you'd say superior. This is yin to treat yang. You go farther down to treat things that are higher up. And then kidney 1 is a good example of this, obviously strongly directing energy downwards and clearing excess from the upper parts of the body. Lung 11, which we already talked about, stomach 45. Liver 1, probably another good example. And, liver 1 is associated with vertex headaches, right? Where the Julian headaches are around due 20, where the liver channel ends. So if you go and you need a liver 1, you sort of have an effect on the upper parts of that channel. All right, other stuff. Turn the page. Fullness beneath the heart. That collects in the epigastrium or chest. This is kind of interesting. Again, these are kind of wood points on the yin channels, metal points on the yang channels. And so there's probably this whole idea that they kind of treat stagnation of qi things. When they say beneath the heart, that's that xin in the Chinese Xin, which can mean heart or mind. It can also refer to this region of the body, kind of Ren 13, 14, maybe as low as Ren 12, however you want to frame that. It's not absolutely solidly drawn lines there, obviously. But that part of the body overall is referred to the Xin region. So in a certain sense, what you're doing is you're kind of treating liver depression, qi stagnation as it's affecting this part of the body. And so I have this liver depression, qi stagnation, little shorthand thing here, liver qi. And examples of that would be like liver 1 or lung 11 being used. And you'll see that in classical books like Sun Si Miao will kind of do that kind of stuff. Disorders of the Shen. So these things are considered to treat level of consciousness. Of course, they're very strong points in terms of sensations. They give kind of a jolt to the Shen. I think energetically that's thought about. You're going to the most distal part of the channel where the flow starts, and you give it a sort of a strong impulse, and this affects the channels and stimulates what's going on in the Shen. So as far as examples of this, probably the most obvious one is pericardium 9, which is sort of used as an emergentology point for resuscitation. Though I think when you look at it, you can also see references to other kinds of things like mania being treated by these points that can clear a lot of heat, or insomnia being treated by these points that can clear a lot of heat, or maybe the kind of effects of the Shen that you can see in febrile disorders. So again, it says these may involve heat as seen above. But they don't have to. So I'll give another example here, but maybe not. So then it says ghost eyes. This is kind of a classical treatment combination. You kind of put the lung 11s together, you put the spleen 1s together, and you burn moxa on there. I almost said boiled moxa. So you burn moxa on there, and that will go through and kind of, again, send a lot of yang through the channels. That's weird about these distal channels because you hear them being used to clear heat, right? We talk about that a lot. But here we're talking more about them being used to sort of add heat into the system and drive yang into the channels through these distal points where the flow starts. And again, you don't see TCM doing that too much, but I think if you go back and you look at more classical stuff, you'll see more of that kind of stuff being used. I know just as a folky thing, if you just kind of take lung 11 and you just kind of do a frictive technique on it, you can create a lot of yang that will move through the channels. And even as a kind of a little self-care thing, if a person's exposed to the cold or something, you can just kind of go and kind of generate that heat into the lung channel, and it kind of starts to force the cold off. It's kind of interesting. So mox could be used there, or you can do even maybe other alternative things that are just sort of more self-care driven. It's just interesting that those points seem to do that. All right, classical usage of the Jingguo points. So like I said, other usages, which we were just referencing, tonification of yang with moxa, that's in the classics, especially Sun Si Miao. And then there's a bunch of empirical points here in different ways. Again, could show up on boards, but are useful points anyways. So spleen 1 is considered to affect bleeding, so especially used for like vaginal bleeding, gynecological bleeding patterns. UB67, we all know, really famous for affecting the uterus, and there's been sort of studies based on that going back, decades, to show that UB67 induces contractions in the uterus. And then SI1 being used to affect lactation. So we got these sort of things that aren't as obvious and easy to understand, but they're sort of important points to understand. Just they have particular empirical qualities to them. Of course, they can be understood. Spleen 1 tonifies the spleen qi and creates more containment, or UB67 connects into the lower jiao, and has an effect on not just the bladder but also other structures in the lower jiao. So you can kind of reason them out if you want to. They're not totally ununderstandable. But anyways, a little bit more empirical. All right, so first point category done. Next is the usage of the transport points for the yin spring points. This is the point at which qi glides in the Ling Shu. Again, they're used a lot to clear heat. I have a number of examples here. They all pretty much make sense. And this we do quite a bit in TCM, right? Liver 2 or stomach 44 or lung 10, heart 8, pericardium 8, kidney 2. We talked about kidney 2 this week in class as the blazing valley that can clear heat from the lower jaw. So it kind of like pretty typical usages there, right? Changes in the complexion. So this connects back to the heart and heat. Again, these are fire points or water points. So they reference back to sort of the fire-water dynamic, reference back to the heart. The heart reflects in the complexion. That's one of the manifests in the complexion. That's one of the things that we learned in that 5-phase chart, like way, way back in the day. And again, a lot of it can have to do with heat that gets into the heart and then, turns the complexion kind of red. Though, if you want to flip this stuff around, and, again, Chinese medicine is good at that thing, you just have a correlation and you can play it in multiple directions. You could use these heart points also to probably generate yang if the heart yang was weak, and then change the complexion away from being pale or something like that. So multiple possible usages, right? Diseases of the yang channel. I give the example here of SI2 being used a lot by Sun Si Miao. He seems to kind of like that point a lot. Again, they kind of just affect the yang channels. The yang channels are probably vulnerable for heat collecting them in them anyways because they are yang. But that's kind of interesting. The next thing it says diseases of the zang, and we can turn the page. And the idea here is that this is used with the Shu stream points. So typical examples would be combinations of things like liver 2 and liver 3, or kidney 2 and kidney 3. And that's kind of a classical thing to do. So again, if you're in the clinic, you want to try something. If you want to try something that has that classical pedigree, that's another example of something that we don't always think of all the time, about to double down on these point categories in this way. I think sometimes you feel like you're needling liver 3 to liver 2, or however you do that. But you can actually put those 2 points in separately and just create the effect where you're getting more of the tonification qualities with the Shu stream points, which we're going to get to in a second, and more of the clearing qualities of the Ying spring points. Okay, that gets us to the Shu stream points, points at which qi pours. So again, there's kind of a flow thing going on. It emanates, it glides, it starts to pour. I guess that's supposed to mean the flow is kind of increasing. First thing listed here is disorders of the zang. Of course, this is really important because these zang points are also yuan source points, right? And so there's sort of a list of kind of major points that are used a lot. TCM, classical thought 2, lung 9, heart 7, liver 3, kidney 3, spleen 3. Almost any of those points are kind of important. Pericardium 7 could be important. You can continue on with the list. There's really no reason not to put all of these Shu stream points here for all of the yin channels. So in any case, that's the idea. We use those points all the time. A part of the reason why they're so important is because they also connect into this yuan source concept. This goes back to something we talked about in physiology way back in the day too, that you tend to think of like 2 levels in Chinese physiology. You sort of have a prenatal level and a postnatal level, and they have to connect. So when you talk about the main channels, they're more like postnatal, right? Qi and blood connecting into the organs, the Zhang Fu system, not into the extraordinary organs so much. And then you have this deeper level that could be related to things like the extraordinary vessels or the extraordinary organs. But in order to make these things connect, you talk about the kidney connecting or the gallbladder connecting in terms of organs. But when you think about it in terms of points, you can say, the yuan source points are a place where these main channels kind of make a deeper connection into the underlying yuan source level of things. From the extraordinary vessels point of view, that's where you get all these overlaps, where these extraordinary vessels have all these connections into the main channels, right? I mean, they essentially are made up of points on the main channels for many of them, right? So it kind of ties the body together. It's interesting. They kind of put a lot of thought into that. So that can have usage then. Certainly you could use any of these points and also treat kidney points or lower jaw points if you want to emphasize that effect. You can still do disorders of the yang channels here. That means we have a couple of things in a row where it says yang channels. Examples common here would be things like SI3, gallbladder 41, triple warmer 3. We had talked about stomach 43 being used by Master Tong when we were in class last time. So, all of this is kind of good thoughts, right, of using these points to treat the yang channels. Some of them we use all the time, like SI3 and gallbladder 41, but I mean, just in general, there's nothing that says that you can't do LI3, though I always do LI4. But if you want to like tap into this idea, and then there are classical physicians who really do. So even though you don't see it as much in TCM, it's certainly on the table for all of us as modern American clinicians who want to draw from wherever we want to draw from. We don't always have to just do the TCM thing. Or we can do combos. Like there's nothing that says you can't do LI4 and LI3 together. Heaviness and pain of the joints. The general way of talking about this is a little bit more five-phasey. You got these earth points that become associated with damp. Again, on yin channels, they're earth. On yang channels, they're wood. So either you're trying to control the damp through the moving qualities of the wood, or you're trying to tonify and affect the earth more directly through the direct correlation on the yin channels, and basically that's the idea. So like lung 9 will treat damp and phlegm in the lungs, or heart 7 would treat damp and phlegm that's collecting in the upper jaw and the chest, and then so on, right? Diseases that manifest intermittently, I mean, one of the big interpretations is this is referencing back to the classic kind of malaria idea, and that these points treat malaria. So then the question becomes, how so? Like, what are they doing? And even though you want to clear pathogens that are forcing their way into the interior in malaria, and maybe these points do that, one of the other ways of thinking about this is because they tend to be kind of tonifying points across the board, right? And so what you end up doing is you end up tonifying the Zhang organs, which then tonifies the correct chi, which then allows the body to deal with the pathogen better. And this is actually kind of like an important and kind of interesting question. You know, we had like a weird case in the clinic where it's very, very difficult. It's a patient who a student was talking about. I haven't seen the patient, you know, so it's not someone I've seen in the shift I've run, but she was just saying he's on another shift, and you know, what do you think? Oh, you know, I just noticed there's all this light coming from this way. Jack in my face. All right, it's not very Scorsese-esque cinematography here, but the picture looks nice in the back. So you want to tonify the correct chi, and in this case, this patient has terrible diabetes and obesity, and had osteomyelitis, and eventually had like amputation done up to the point of the ankle of the lower extremity, and then the question became, you know, what do you do? And then what you can do is you can try to, if there's still infection in the lower extremity, you can try to bring chi and blood to that area. But of course, you need chi and blood to go to that area. If you don't have the chi and blood, just circulating it isn't going to do you so much. So gets into this idea of these shoe points, these shoe stream points, where if you kind of tonify them, you get more resources, more correct chi to then deal with things like chronic pathogens, like maybe if you had someone, though of course that case is super difficult, hard to say you'll be able to do too much to help that person, though the effort is noble. Classical usage of the transport points. Next thing is Jing River. And I don't have a water imagery here, but obviously it's a river, so you can get the idea of what's happening there. I don't know why I don't have it here. In any case, it's cough and dyspnea, which we had talked about earlier. They're metal points and fire points. Therefore, they're either controlling the metal on the yang channels, or they are treating the metal directly on the yin channels. So they treat diseases of the metal. So cough and dyspnea, chills and fever, those things that could be thought of as having relationships back to the metal. And examples would be things like lung 8, UV60, and kidney 7, and LI5. Diseases manifesting in the patient's voice, that's basically the same idea, right? And again, big examples would be lung 5, LI5, and PC5. When you get to PC5, it gets a bit more interesting, because at that point, you're probably talking more about psychiatric stuff as opposed to infectious disease stuff. Oh, it depends. You know, the Chinese spend a lot of time talking about effects on the Shen that are being caused by infectious disease, so it could be a little of that. But in general, you might be talking more about psychiatric disorders or neurological disorders that are affecting the voice, and PC5 might be understandable in that way too. If you think about the infectious disease, though, that is interesting, though, because it's a metal point. It does treat the upper jaw. So it could be examples like somebody has pneumonia, and they're kind of out of it, and they're rambling in some kind of non-responsive state. And you can think, okay, paragraph 5 is on the one hand treating yin level and infectious disease stuff that is sort of febrile disorders affecting the voice, and it also has that metal quality to it. So kind of interesting, kind of an idea there. Pericardium 5, we don't use it too much. We tend to use pericardium 6 more, right? You see that much more in the TCM books, but there's definitely some classical idea that pericardium 5 has psychiatric qualities to it, and some people think of it as being almost like an additional ghost point, even though it isn't amongst Sun Sea mouse ghost points per se. Diseases of the sinews and bones. This is interesting then, right? Kind of a unique thing in this point category to specifically see that start out. Here I gave spleen 5, kidney 7, UB60, LI5 could be there, SI5 could be there, any of those points where you might want to treat problems with the sinews and bones along the channel. Or maybe just in general, like a kidney in 7 and spleen 5 might be useful to control damp and water that's affecting the joints overall. So, some interesting stuff there possible within that point category if you want to step in and use that. Okay, then finally we're to the Hess-C points, kind of finishing up this list. This is the point at which qi enters inward, so this is where this is supposed to internalize, like the water finding its way into the sea. And then you get these sort of point functions that are a lot based on the idea of water points and earth points. So it's another example where the 5 phases can kind of help us out here. Counterflow qi and diarrhea, again, they're earth and water points. So on the yang channels, they're earth points that directly affects the GI tract. And then on the yin points, it helps to control water and dampness, which contributes to things like diarrhea for sure. So that's the basic gist of this. So it also says diseases of the stomach and related to diet. So the earth points on the yang channels are good for this, obviously, stomach 36, LI11, UB40. I don't have gallbladder 34 there. I probably should. You get the idea. And then with water points on yin channels, you can imagine things like spleen 9 and lung 5 working to do this. If you had somebody who had a lot of phlegm that was collecting in the lungs related to dietary factors, you could use like a lung 5 as an example. There's also the point to get here of the lower Hess-C points. I think we asked about that in the first test, but I don't remember. But again, it's fair game. It's in this packet now. So stomach 37 for the LI, stomach 39 for the SI, and UB 39, obviously for the triple warmer. So those are points that you got to know are connected back to those organs. There is this idea that stomach 37 is better for treating the large intestine as an organ than LI11, and the same with stomach 39 as opposed to like something like an SI8. The SI8 thing seems pretty clear. Probably most people would agree with that. This stomach 37 thing is kind of interesting. And empirically speaking, I don't know. Sometimes it seems like LI11 does do a good job of treating conditions at the large intestine, especially things like constipation and heat. That might be something you have to try out for yourself. All right, diseases of the Fu. Again, this gets us to the idea of diseases of the Yang, Zhang overall, which is more like a shoestring thing. And then diseases of the Fu organs. And so on the Yang channels, these do become pretty important points, like stomach 36 and gallbladder 34, the lower Hess-C points. So that's interesting. And it might also be the idea that, maybe these points on the Yin channels affect the Fu organs too. So maybe spleen 9 affects things that would impact the stomach or the rest of the GI tract, or the UB by promoting urination, like that kind of a concept. Liver 8's a bit trickier that way. People debate a lot about what exactly the usage profile liver 8 is supposed to be. Some people love it for tonification, and it is a water point, so it tonifies wood. But maybe it also has some way of affecting the Fu organs. One can imagine treating the gallbladder, for example, or maybe the wood, the way it would affect the stomach, small intestine, and large intestine. So that's kind of the idea. Finally, diseases of the skin. So this is interesting. Again, these could be acute things or maybe chronic things. When you get to the chronic things, it's interesting because you get the earth and water as the 2 phases. Earth for the yang channels and water for the yin channels. And a lot of the chronic diseases have something to do with damp heat some way or another. Eczema and psoriasis have these damp heat kind of ideas around them, right? So maybe when you're doing things with these Hess-C points, you're getting also into those 5 phase dynamics. But in any case, major points for this are LI11, UB40 is a big one, obviously. And you see liver 8, my teacher was really big on needling liver 8 for diseases of the skin. The liver 8 thing is hard to say it's totally because of this Hess-C thing, though it's a major tonification point for the liver, and a lot of times it seems like you need to be able to tonify liver blood for conditions that are drying out the system, right? So if you have like an eczema patient and it starts out weeping, then you're treating the damp heat idea of these points. But as that damp heat starts to cause the skin to dry out and scale, then you have to kind of generate more yin and fluids, and then liver 8 becomes sort of understandable even in a different way. Anyways, that is that whole category. So I think the first of these lectures are done. That's about 29 minutes and 54, 5, 6 seconds. So I'm gonna shut this off and we'll do one more lecture and we can say that we kind of carve everything up. See you guys in a little bit.